No more cervical cancer. Cervical cancer is usually caused by the human papillomavirus, HPV, which is transmitted through sexual contact. In the United States, cervical cancer, cancer of the cervix, is the third most common gynecologic malignancy and is the most common gynecologic malignancy in young women. The average age at diagnosis is about 50 years, but women are most often diagnosed between the ages of 35 and 44. Worldwide, rates are highest in sub-Saharan Africa. Cervical cancer is the most common cancer among women in 23 countries and the leading cause of cancer death in 36 countries. About 80% to 85% of cervical cancers are squamous cell carcinomas, which develop in the flat, skin-like cells of the cervical wall. Most other types of cervical cancer are adenocarcinomas, which develop from glandular cells. Precancerous changes in cervical cells, cervical intraepithelial neoplasia, and cervical cancer are almost always caused by the human papillomavirus, HPV, which is transmitted through sexual contact. HPV viruses can also cause genital warts. Over the past few decades, cervical cancer rates have steadily declined in countries with access to the HPV vaccine, cervical cancer screening, and treatment for cervical intraepithelial neoplasia. Risk factors for developing cervical cancer include increased chance of sexually transmitted infections, e.g., having sexual debut at a young age, having multiple sex partners, or having sex partners with risk factors for sexually transmitted infections, oral contraceptives, smoking. Precancerous lesions are cancer of the vulva, vagina, or anus, a weakened immune system due to conditions such as cancer or AIDS, or due to medications such as chemotherapy drugs or corticosteroids. HPV can be transmitted through any type of sexual activity, including oral, genital, or anal contact. HPV infection is very common, with about 80% of sexually active people being exposed to HPV at least once in their lifetime. Many HPV infections last only a short time, but some people may have HPV infection more than once, and some HPV infections last for years. Precancerous lesions are often asymptomatic. In the early stages, cervical cancer does not cause any symptoms. The first symptom of cervical cancer is often abnormal vaginal bleeding, most commonly after sexual activity. Spotting or heavy bleeding may occur between periods, or periods may be heavier. Large cervical cancers are more likely to bleed, and there may be a purulent vaginal discharge and pelvic pain. Lower back pain and leg swelling may occur. Urinary tract obstruction may occur, and kidney failure may occur if untreated.